disease for a healthy nation. Together with the DOH, local government units, industry and media partners, professional and non-government organizations, we have been able to bring our mission to physicians, midwives, nurses, allied professionals, policymakers, advocacy groups, and the general public, both here and abroad. And what is the PFV mission? The PFV mission is to advocate for, educate, and conduct research on vaccination as a means of disease prevention to improve the quality of life of children, adults, and their families. This mission has taken us to answer a great challenge in this era of COVID-19. Unfazed, we have chosen to host a webinar that will tackle strategies on immunization during the enhanced community quarantine. We are dedicating this webinar to our beloved Dr. Sally Gatchalian, a friend and mentor who embodied the PFV core values of being a proactive visionary, demonstrating integrity, excellence, social responsibility, who called us to collaborate with local and international communities. Before we move to the panel discussion, let us get to know the woman that inspired us to reach our vision and mission. We invite you to a fuller view of the tribute that we have prepared for Ma'am Sally in the PFV website. Now, let us start with the PFV panel discussion. May I introduce to you our current Director 4 of the Epidemiological Management and Informatics Technology at the Department of Health, Director 4 for the Bureau of Local Health Systems Development of the DOH. To be our panel moderator, let us welcome Dr. Enrique Tayag.
Thank you, Dr. Shelley, and welcome to PFV's Real Talk with Experts. This is Dr. Eric Tayag, who will be your moderator for tonight's webinar. But first, let me introduce our panelists. And let me read. We have Dr. Maria Wilda Silva. She rose from the ranks. She is a young doctor. She is my colleague at the Department of Health. She is now the National Immunization Program Manager for the Department of Health. Let's all welcome Dr. Maria Wilda Silva. The next panelist is Dr. Fatima Jimenez, or Tim. Hi, Tim. Dr. Gimenez is the Vice President of the Pediatric Infectious Disease Society of the Philippines. She holds many titles like as training officer of the PIDS section of the Philippine Children's Medical Center. He's also member of the editorial board of the Pediatric Infectious Disease Journal. And remember this, she is a member of the Disaster Preparedness Team Philippine Pediatric Society. Our third panelist is Dr. Mario Panaligan, the immediate past president of the Philippine Society for Microbiology and Infectious Disease. She is currently the chair of the Department of Medicine of my alma mater too, the University of the East Ramon Magsaysay Memorial Medical Center. He is the Assistant Professor of Medicine, College of Medicine, also of UERM-MMCI. And our last panelist, let's welcome Dr. Eleenor Serafico Gumpal. She's currently the Immunization Program Manager of Las Pinas City Health Office. She's also the City Health Physician at the Pamplona Uno Health Center and is a visiting consultant in many hospitals in the area. Let's all welcome our panelists for tonight. Our webinar, we'll talk with experts, strategies on immunization during enhanced community quarantine. Ladies and gentlemen, let me begin this webinar. We are all trapped in our homes or in our work if we are working in hospitals. We'd like to thank our frontliners in hospitals for giving this service to the Filipino people. But how did we find ourselves in this trap? How do we get out of it? Many ask this question, when will it end? We are now on the 41st day of our enhanced community quarantine. It was extended until May 15. But many ask, how does every child get their vaccination? Is there a way that we can vaccinate children? Remember, just before COVID-19, we were able to complete the schedules for the sub-national immunization campaign for polio. Let's listen for the opening statement from Dr. Wilda Silva from the Department of Health. Dr. Wilda, how do you think immunization will play out on the enhanced community quarantine? Can we have your 2 minutes thoughts on this?
Thank you, Dr. Tayag, and good evening to everyone. Now, let me start by saying that immunization is an essential healthcare service, and it should be made available even in the context of COVID-19 pandemic. And because we see immunization as an essential healthcare service, then we need to make this available in order to avoid vaccine preventable diseases and outbreaks and overwhelm further our overwhelmed healthcare system because of COVID-19. Now, let me give you an example why immunization is very important. The next 2 slides is on measles. You can see here that early in 2020, we experienced an increasing number of measles cases. And because of early intervention sometime in January and February, we were able to bring down the number of cases. Also, in the next slide, we can see that comparing this trend in 2019 to 2019 outbreak, we are doing pretty well because of the immunization against measles, the supplemental immunization, as well as outbreak response. Now, in March, if we can have the next slide, in March, we declared the COVID pandemic. And because of this, we implemented the enhanced community quarantine. And we saw the effect on routine immunization service delivery. And because of this, the DOH-National Immunization Program issued an interim guideline for immunization in the context of COVID-19. And what is highlighted here is the role of the local government unit. In the context of COVID-19, where we are implementing enhanced community quarantine, we still believe that immunization should continue. And this is now the role of the local government unit because they have to assess the situation. You have to strike that balance between protecting the children against vaccine preventable diseases and at the same time protecting the community and the health workers against COVID-19. So with this, if we can move on, We also issued a memorandum conducting on the conduct of measles response immunization in selected areas. And the last two slides are examples on how the local government units and our partners in the immunization field on the conduct of the routine immunization as well as outreach immunization. Next slide. Outreach immunization in areas conducting enhanced community quarantine. So you can see here a lot of strategies, some of the strategies that they have implemented just to achieve that sort of normalcy in delivering immunization services. So we saw disruption, but then we are going back to routine immunization when feasible. So last slide, you can see here as well, a very good example wherein clients are called to a gym and vaccination was done, observing that physical distancing in between clients. So these are the strategies where we can deliver immunization services in spite of the enhanced community quarantine and the COVID-19 pandemic. Over to you, Dr. Tayag.
Thank you, Dr. Wilda Silva. What a nice picture. 6 feet of separation. And you're saying that immunization or vaccination can still happen in the background of an ECQ. But DOH has also reached out to the private sector. Can we listen to Dr. Tim Gimenez on how exactly is the private sector coping and supporting the program on immunization of the DOH? Thank you.
Dr. Tayag. Good evening, Dr. Tayag. Good evening, everyone. Thank you, Dr. Wilda, for that excellent presentation. Your question, Dr. Tayag, is how are we coping? Right? We're struggling, but we are coping. I think I'd like to say that for the private sector end. So we all know that we have forgone, we have delayed, or we have rescheduled some of our activities, which includes immunization. And we know that this is something that we need to address because there is a rise of vaccine preventable diseases. But thank you, Dr. Wilda. Even if I see that there are some cases of measles, if I compare it to the year before, at least we know that the mass campaign for measles has had its effect and there are lower cases of measles. So really the decision to continue immunization is based on a risk versus a benefit ratio. And from the private sector, we should network with our local government units so that we can implement immunization services if it's not possible on the private sector end. So what are the things that we have seen, okay, in the past couple of weeks? The next slide shows you some pictures of private doctors doing teleconferences, drive-through vaccinations. As you can see, one photo, I think this is from the Department of Health Facebook, wherein you see a doctor immunizing a person in the tricycle. You also see that this doctor, okay, is in full PPE gear. You see his surgical mask, his shield, right, and his gown, and I'm sure he has gloves on and his surgical cap. So these are the things that the private pediatricians have resorted to. So they have put up teleconferences with their patients, have pre-scheduled clinics, and for those who have continued with their clinics, there is, as you know, in the large facilities, there is some form of triaging. So the well children are separated from the sick children. So what are the other strategies that can help us in conducting our immunization services? As I have said, there is some form of triaging, and we really need to separate the well from the sick child visits. And this can be facilitated by pre-arranged clinic calls. So we see everyone on an appointment basis. And from the strategies that have been employed in the local government area or in the local government side, you did see that this is also being done by the local government unit. So for sick children, mostly they are triaged in most hospitals and land in the ER for further disposition. Now, once you have done your pre-arranged clinic call, then you get to survey if it's okay for you to administer the immunization. And during the appointment proper, the healthcare providers and assistants should be in proper personal protective equipment. And all patients who come in should be asked to wear a mask, observe proper hand hygiene, observe physical distancing, and cough etiquette. In the clinic, there should also be regular and proper disinfection of all equipment before and after each patient encounter. What are the other strategies? It would be nice that if you are holding multiple clinics, it would be nice for you, it would be ideal for you to direct patients to a dedicated clinic for well child visits only. This is a thing that we are presently faced with. I think infrastructure problems. So if it's possible, you need to arrange with your hospital or your clinic administration to set up a vaccination clinic for well pediatric and adult patients as well. This networking referral system is also something that you can do. You can network with your colleagues so that you can look into where your patients are situated in. There might be some of your colleagues, all right, who are not under enhanced ECQ. If your community is not regarded as, if the community is safe in a sense that it's not in total lockdown, then you can probably direct your patients to other places wherein there are available pediatricians. And one thing you need to tell your patients and the parents, most especially, and the caregivers, there is no need to worry because we can facilitate catch-up vaccinations. Talk to your patients' parents about checking their baby book and digitalize what you can with your parent partners. We have some interim guidelines on screening, assessment, and clinical management on pediatric patients suspected for confirmed coronavirus disease and vaccination guidelines during the COVID-19 pandemic. And you can refer to this so that you can be guided on how best to give your immunization to your patients. Thank you.
Thank you, Dr. Tim. Wow, DOH and the private sector working together, how can we fail? But that's interesting, a drive-through vaccination. Maybe we would go back to that.
Yes, sir.
Those who have just, yes, Tim. Those who have just joined, this is Real Talk with Experts. A hard look at the strategies on immunization during enhanced community quarantine. This is a webinar brought to you by the Philippine Foundation for Vaccination Incorporated as we celebrate our 20th year. Did you know that I manage the DOH COVID-19 hotline? It's 1555 or 02894 COVID. This hotline is open to all networks and it's 24/7. And I remembered in one of those calls, there was a question given to me. Which vaccines would benefit the elderly? And guess what? We have Dr. Mario Panaligan. Dr. Mario, welcome to this webinar. Please share with us exactly if Dr. Tim revealed that there are guidelines for child immunization, do we have the same guidelines for adult immunization? And how are you coping with this demand for vaccination for the elderly? Welcome, Dr. Mario Panaligan. Thank you.
Thank you, Dr. Tayag. And of course, thank my classmate, Timmy, for describing how we can actually do it in terms of immunization. And certainly, I'm an internist, and therefore, our concern is really the adults. And I'd like to, of course, correct some misconceptions about vaccines, the usefulness of these vaccines in adults. Definitely, at this time for COVID-19, there's no vaccine. However, there are vaccines that can be useful for adults, particularly the elderly age group, which are the more vulnerable population for this COVID-19. And if you look at the data, with COVID-19, we can see that many of those who develop severe infection due to COVID-19 are the elderly and those with comorbid illnesses like diabetes, hypertension, heart disease, and even cancer, as well as chronic obstructive lung disease and chronic liver disease and chronic kidney disease. And therefore, we have to look at all these patients when we talk about vaccines. Now, we, as featured here in the slide, definitely we have the guidelines for adult immunization, and certainly we recommend giving pneumococcal vaccine for selected group of patients as well as influenza vaccine. Now, these two respiratory infections are quite common. As we look at the next slide, definitely pneumonia remains one of the leading causes of death as well as morbidity in the Philippines. And certainly we have to address this primarily by preventing the lung infection. Next slide. And when we look at this particular slide, we can see that comorbid illnesses definitely pose additional risks in terms of the complications related to pneumonia. And definitely that's the reason why we recommend pneumococcal vaccine for patients who have comorbid illnesses, as well as those who are elderly or at least 50 years old. And of course, in addition to pneumococcal vaccine, we also recommend seasonal flu vaccine. And this month is actually the best time to receive it, primarily because the usual seasonal flu starts at around June when the rainy season begins. And definitely, if you're going to receive the flu vaccine, it's quite important that we receive it before the onset or before the surge of the cases of flu vaccine. And we have to remember that in the Philippines, you also have another season, of course, during the times of December and January, where there's also an increase in the flu cases. And therefore, we must actually receive the flu vaccine, not all year round, and ideally, we should receive it every year. And when we talk about these two vaccines, therefore, definitely there are indications, and there are usually timing that we also need to know. For example, when we talk about pneumococcal vaccine, there are two types. We have the conjugated, which should be given first, and then a year later, we have the polysaccharide pneumococcal vaccine. And these two types of vaccine for pneumonia can definitely protect us against Streptococcus pneumoniae, which can cause invasive disease even in the elderly age group. Thank you, Dr. Tayag.
Thank you, Dr. Mario Panaligan. Now here's our situation, colleagues, and those who have just joined us with Real Talk with Experts, Strategies on Immunization during Enhanced Community Quarantine. Everybody stays home. Those who leave their homes should have reason to actually leave their homes, to buy food, some medicine, or if they're sick, maybe they have to go to a hospital or find a doctor. But really, what happens when everybody stays home and children have to get their vaccinations? We have some strategies, as mentioned by Dr. Team and Dr. Mario, but we'd like to find out really what happens there at the grassroots. Let's welcome Dr. Eleenor Gumpal, the Program Manager for Immunization in Las Pinas. Welcome, Dr. Eleenor Gumpal. Thank you.
Good evening, Dr. Tayag, and to all the panelists and all the participants or the attendees in this webinar. So I'm Dr. Eleenor Gumpal, Immunization Program Coordinator of Las Piñas City, and I am representing the frontliners in the community at barangay to city level. So before the COVID-19 crisis, the National Immunization Program in all LGUs in NCR faced a very challenging polio outbreak response, which concluded last March 8th. Then after that, the local transmission of COVID-19 was declared on March 7. Thus, the Luzon-wide Enhanced Community Quarantine or ECQ was enforced by the government. During the ECQ period, routine immunization is still being continued as part of the essential health services in health centers. We have enough vaccines available for infants like the BCG, hepatitis B, pentahib, oral polio vaccines, IPV, pneumococcal conjugate vaccines, MMR, and we also have tetanus diphtheria for pregnants and anti-rabies vaccines for animal bites. However, a marked decrease in vaccinees, about 50% or more per immunization day was noted. Just like in Las Piñas City from the slide. So our immunization coverage for the first quarter of 2020 decreases as compared to the first quarter of 2019. So this decline increases the number of unimmunized children that will eventually lead to the increased risk of vaccine-preventable diseases and potential outbreaks like measles and polio in the days ahead or immediately after the ECQ. However, on the brighter side, there's also a decline in the incidence of measles, pneumonia, and even diarrhea during the enhanced community quarantine. And this is primarily due to the social distancing, hand hygiene, mandatory wearing of masks, and other DOH preventive measures to beat COVID-19, which also offers protection not only from COVID-19, but also from other vaccine-preventable diseases and other common childhood illnesses. We from the frontliners are facing different challenges on immunization during ECQ. So usually parents, guardians, or caregivers refuse to bring their child to the health centers for immunization because of fear that they may acquire the infection and eventually put not just themselves, but also their child at risk. Manpower advocacy determines the health center's operational capacity. So vaccinators like nurses and midwives are engaged directly in the COVID response. Some health centers are forced to close temporarily whenever a health worker became infected, while other staff will have to go through a 2-week quarantine. Some health workers, due to lack of transportation, have to endure walking daily to the health facility. And they also endure the social discrimination. So vulnerable health workers like the elderly, so we also have barangay health workers that are senior citizens, or those with comorbid illnesses, we also have to limit their exposure. So physical distancing in health facilities with limited space and the separation of curative and preventive services will limit the number of patients to be accommodated. Hence the need for alternative spaces for immunization services like daycares, gym, or the basketball courts. Availability of PPEs for infection prevention and control is essential for health workers to protect themselves in the delivery of immunization service during or even after ECQ, because it will now become the new normal. But the question is, how long will the supplies last? So in spite of all these challenges, still, by all means necessary, considering the benefit versus the risk, the goal is to immunize all children, leaving no child behind, to achieve high population immunity against vaccine-preventable diseases, and thereby prevent further disease outbreaks. So with that, thank you po. Good evening. Thank you.
Maraming salamat, Dr. Eleenor Gumpal. Balik tayo sa 4 nating panelists ngayong gabi. Dito sa Real Talk with Experts. alam nyo, tignan natin yung ating sitwasyon. Let's look at the situation. Everybody stays at home. Then it was mentioned that even health workers may stay at home. Maybe they're sick. Maybe they're quarantined. At kailangan nila ng personal protective equipment. May nagtatanong nga rito eh. Kung well baby ba, kailangan pa rin may PPE? Yung ba ay para hindi kayo makapanghawa or hindi kayo mahawa? Kasi alam naman natin, may mga asymptomatics, hindi natin alam, infected pala at katunayan, pag tinest natin ay positive. So, pwede nating malaman kay Dr. Eleenor Gumpal, ano ang talagang nangyayari sa inyo sa health center? Nagbabahay-bahay pa ba kayo, door to door? Paano yung pinapaalala sa mga magulang na kailangan bumalik sila sa ayon sa schedule ng kanilang pagbabakuna? How do you do this? May sapat ba kayong PPE? O mas marami kayong araw na walang serbisyo? Ano ba talaga nangyayari diyan sa Las Piñas? Dr. Gumpal?
Yes, yes, Dr. Tayag. Actually, what's happening as of now, so mostly since we have local transmission of COVID cases, we have 133 cases as of today. So not only from Las Piñas, even from the rest of the LGUs. So if there's a confirmed cases and a high transmission of the COVID-19. So of course we are protecting the children. So, but the problem is with these cases and more confirmed cases, even for the health center staff. So most health centers are open, but they mostly they're open, but for the immunization. So we are temporarily suspending the immunization, because the risk is higher. So we have to weigh the benefit versus the risk. So the risk of COVID is higher than the benefit. So case-to-case basis po kasi if there is a community or area na walang case, so if there's no case of COVID and there's a cases of measles in the area, so we will vaccinate. So we have lots of vaccines and we also have PPEs. So we have the face mask, the gloves. We also have suits, the full gear suits. We also have the goggles. But we didn't do the routine daily. So unlike before that we are doing the daily routine immunization and we are doing the door-to-door. So like in polio, so we did a fixed and mobile fixed post. So as of now, we have to consider the benefit versus the risk and the status of the community, whether there are cases of measles or any other vaccine preventable diseases. So we still can immunize. So we still are immunizing if the benefit outweigh the risk. So
thank you, Dr. Eleenor. Okay. Puputulin kita dyan sapagkat nakakabahala yung sinabi mong sitwasyon. Gusto nating malaman kay Dr. Wilda Silva, ang National Immunization Program Manager ng Department of Health, Kagawaran ng Kalusugan. Dr. Wilda Silva, parang ang sinasabi ni Dr. Gumpal ay parang may hide and seek tayong sitwasyon sa ilang mga local government unit na kung saan kung maraming kaso ay sinususpend muna nila yung pagbabakuna at ang pangunahing objective muna ay safety ng mga health workers, safety ng mga nasasakupan nilang kababayan doon sa kanilang komunidad. Ito ba ay inaasahan ng Department of Health, Dr. Silva? Thank you.
Yung ating ginawang guideline, interim guideline on immunization amidst COVID pandemic, we highlighted the role of the local government unit and monitoring and frequent assessment of situation, COVID situation, and vaccine preventable diseases situation is emphasized in there. hindi natin maisasawalang bahala that while the COVID pandemic is ongoing and local transmission is ongoing, ayaw nating maisaalang-alang ang safety or kalusugan ng ating frontliners at ng komunidad. That's why, as I have mentioned earlier, we have to strike that balance between one hand is protecting the infants and children against vaccine-preventable diseases, and on the other, ensuring the safety of our community and our frontliners. Inaasahan po namin ito. Kaya nga po, ina-assess namin ang sitwasyon regularly, both the COVID situation and the vaccine-preventable diseases situation, and sending out guidelines or memorandum or policies that will guide the local government on how to implement immunization in the context of COVID pandemic. And we are also now planning a supplemental immunization once we achieve that degree of normalcy. Kasi sa amin, sa National Immunization Program at sa buong kagawaran ng kalusugan, the more we adhere to the COVID policy of strict border control and stringent lockdown, the shorter will be the enhanced community quarantine, and earlier we are going back or attain that degree of normalcy, and we can implement routine immunization just like how we implemented in the past. Kaya nga po, ang ating emphasis is, although we want that immunization program, immunization services will be continued, we abide by the COVID policy of strict physical distancing and limiting mobility of our community so as to prevent transmission. Maaga nating matatapos ang outbreak ng COVID, mas maaga tayong makakapagbalik sa normal na sitwasyon at pagbigay ng serbisyo pagbabakuna. Over to you, Dr. Tayag.
Thank you, Dr. Wilda Silva. It seems that we have a catch-22 situation here wherein we encourage people to stay home, but we don't want them to miss their vaccinations. And while there are local governments coping with this, a hide and seek event, there's also this strategy that if we leave the enhanced community quarantine, it's possible that we can do catch up, and hoping that we also did not have outbreaks of vaccine preventable diseases, especially when everybody stayed home and followed that quarantine and isolation at home. So we're keeping our fingers crossed that there are no vaccine preventable disease outbreaks. And if it will be very difficult for local government units to even think of having these immunization services, this routine immunization services, then a catch-up will always be an option. Now, there are questions from those who have joined here. For example, for Dr. Mario Panaligan, can we administer the flu vaccine simultaneously with PCV under a booster schedule? And there are also questions here about the rotavirus vaccine, if up to what age can it still be given, because if the lockdown is going to be enhanced, and the lockdown will be extended, then many children will miss it. That's for you, Dr. Team. And how about this question wherein the health workers do not have enough supplies of these vaccines, and for some reason they have difficulty getting the supplies? That's for you, Dr. Wilda. can we start with Dr. Mario Panaligan regarding that simultaneous flu and PCV?
Yeah, thank you, Dr. Tayag. The two vaccines that are available are both inactivated, and therefore they can actually be administered at the same time. So there will be no problem in giving the two vaccines simultaneously. In fact, I have to emphasize that even during this time, during the COVID pandemic, there's no reason for us not to administer these vaccines. So there's no contraindication in terms of giving these vaccines at this time when there is this pandemic. So the sooner, the better. As I've said, the best time for the flu vaccines to be given is now, April. One formulation already available, and therefore we can give this vaccine anytime. But make sure, of course, that I think I have to repeat what Dr. Jimenez said. No, when we are administering this, we also need to be very careful to check and make sure that we are also protected, no? Because certainly, because there's still this COVID, we can actually still acquire COVID infection when we are just doing our jobs, and therefore, the process of administering it should always make us protect, we should make sure that we are also protected when we give these vaccines. Thank you.
Thank you.
Thank you.
Thank you, Dr. Mario. Now, Dr. Tim, going back to the question that was actually shared to us in this webinar, how do you go about these children completing their doses when we are in a lockdown? So many children will not complete their primary doses, and so what do we do? Dr. Tim?
Dr. Tayag, for that question. So how do we do catch up? Basically, we have a schedule for that. No? The thing that we need to do is to complete the primary immunization. And for most of the inactivated vaccines and some of the live vaccines, right, you can do catch up, right? So there is no problem with that. You can even simultaneously administer both your live and your inactivated vaccines. So I don't think there's going to be a problem with that. But as we know, if you get them at a later age, let's say take for example, your hip, right? So if you get them at around 15 months already, you know that there will be no additional doses. So this schedule of catch-up is actually embedded in our guidelines. So I would direct you to that because it gives you guidelines, okay? It gives you the schedule on how to do catch-up. Now, for the local government unit, I am not too sure if catch-up is done beyond the age that they really are given. Let's say if they don't come for the 6, 10, 14, I'd like to direct this question also to Dr. Silva and to Dr. Eleenor, that if they never got to get their first or their looking at getting their second, but they're beyond that age group, for the local government unit, do we do catch up, and is it possible? Thank you.
Okay.
I answered the question, Dr. Tayag, and I threw a
Thank
question.
you. Yeah, thank you, Dr. Tim. It's nice to see you on this webinar. Okay, this is for Dr. Wilda. Are we not running low on supplies of these vaccines? What's the conditions out there that really, how can we know really that the vaccine coverage is not due to the enhanced community quarantine, but to some vaccine hesitancy? How can we know? So one, do we have low supplies of the vaccines? Can we assure everyone that we have a good supply of vaccines, even with the lockdown? And two, how do we really know that the vaccine coverage which has been disrupted is not actually due to the lockdown, but something more, vaccine hesitancy? Dr. Silva, and of course, what Dr. Tim has asked you a while ago. Thank you.
You can unmute. Okay. Thank you, Dr. Tayag. I'm happy to report that for 2020, we have enough vaccines. Our supply in our ITM is good until the third quarter of 2020. Now, the challenge, however, is the distribution of vaccines during the enhanced community quarantine, because you all well know that some flights were canceled. So our challenge is bringing this to the different islands, particularly down south. But for Luzon, we do not have a problem in the distribution of vaccines. So for whether the low coverage or low immunization coverage is due to the lockdown or due to vaccine hesitancy, I think now, based on the reports coming from our regional EPI managers, it's more because of the lockdown. You know what? After the 2018-2019 measles outbreak, we sort of solved that vaccine hesitancy issue. And a lot are now going to the health centers to get their immunization, or have their children immunized. So I want to believe that now the low coverage is secondary to the lockdown because of our human health resource pooled to support COVID, as well as mothers are not bringing their kids regularly to the health center because of this lockdown. And for the question of Dr. Timmy, yes, we are offering catch up. We do catch up for some antigens until 59 months, particularly for measles and polio. Our pentahib is up to 24 months. So yes, our regional managers, because we have this memorandum on doing catch up under the pinaigting na pagbabakuna strategy, wherein we look at our target client list, we search the name of the child, we look for the child in the community and deliver that missing antigen based on their age. We're doing that. And we will do that after this COVID thing has been put to, at bay. Thank you. Over to you.
Thank you, Dr. Wilda. Just a thought, Dr. Eleenor. There's a question here. Exactly what PPE must you wear? Is it face mask? Is it the N95 mask? Should you have a gown, an apron? And even, because we've seen pictures earlier that it's vaccination, but everybody looks as if they are in the operating room or they are in some ICU. So we want to know exactly what's the practice out there in Las Pinas, and maybe later Dr. Wilda can enlighten us exactly what's the guidelines for this PPE. Is it face mask versus N95 mask? And there's also a question here that there are LGUs that actually turn away babies accompanied by their mothers for vaccination because they say, oh, don't come here because you might just get the COVID if you have your vaccination visits in the health center. Is that true? Dr. Eleenor, can we hear from you?
Yeah, thank you, Dr. Tayag. So for the child who's coming in the health centers, so if their mother will bring the child in the health center, so we will not miss that opportunity. So we will vaccinate the babies since we have vaccines and we have proper PPE. So, but we don't encourage them to go. But if kung andyan na po, so we will vaccinate eventually, but as long as we follow the proper infection prevention control. So what we are doing in the health centers, so what is available PPE we will use. So if there's disposable gloves, we use gloves, and with a face mask, if there's N95, we usually wear the N95. And we select, since we don't have so much N95, and we also have surgical masks in the health centers. So we prioritize that those handling the COVID patients, like the nurses, doctors, and the midwives, and the barangay health workers who really faces the patients. So they are the ones wearing the N95 mask. Other staff, like for example, we have utilities or stock clerks and other staff that's not handling directly the COVID patients. So we just gave them the surgical mask, and we have gowns, so it's available, the disposable gowns, and we're using the PPE, like the scrub suit, like, so the overalls, when we have confirmed cases or COVID suspects. But if none, if we're, for example, we don't have suspects or patients, but the mother came in with a baby for vaccination, so we will not use that scrubs or that that gown. So just
Thank you, Dr. Eleenor. Thank you,
Yes.
Dr. Eleenor. Wilda, do you agree with what they do, what they actually practice in Las Pinas? Dr. Wilda, quickly.
Well, our guideline says they have to at least do that hand washing, that universal infection control thing. Do hand washing before and after each client. The surgical mask is also recommended or encouraged to be used, but not the whole, but not the whole PPE, the scrub, or how do you call that, or the N95. We usually reserve N95 for our frontliners in the hospitals. But
Thank you, Dr. Wilda.
thank you, Dr. Tan.
I don't have a question, but I have a few suggestions on immunizing adults and older persons. You know, there are captive audiences, so to speak, no, that we can immunize more easily. These are older persons in nursing homes and homes for the aged. So if there is a good strategy to bring the vaccine to them, then you don't have to worry about them coming to the health center or having one person go to every house. No? Another population that can be easily immunized, I think, are those who are already working in essential services during this COVID-19 era. These are our policemen, no? These are our supermarket employees, those who are known to be giving essential services. They can be easily identified. And I think these should be priority groups for immunization because they are doubly exposed to COVID. And at the same time, when the flu season comes in, they will be also the ones who will be most exposed. Of course, our healthcare workers in hospitals should be, you know, some of the prime recipients of at least a quadrivalent flu vaccine. So it's not too impossible, especially in these populations. That's it. Thank you.
Thank you, Dr. Shelley. What a wise idea coming from you. And Dr. Tim, I am actually excited about that photo. Can you just please describe it more? A drive-through vaccination system. How does that happen, Dr. Tim?
Actually, Dr. Tayag, that was just one of the innovative ideas that we got to see. I think I'm not a Facebook fan, but it was shared to me. And there were like some friends who were referring to doctors who were making house visits and drive-through. Now, I think this is not to probably there's no recommendation, but like what Dr. Shelley was saying, you bring the vaccine to them, but then you also have to make sure if you're going to do that house visit is that you are also protected and you're protecting your patient, also making sure that you don't have, you're not getting anything. That's one. So for the drive-through, there was this article in New Zealand that referred to a drive-through clinic or a mobile clinic, but there were like some things that you need to consider. Like, take for example, you can't just, of course, you know that we need to observe for adverse effects. So in New Zealand, the one that they were referring to, the drive-through clinic, it's actually close to a hospital or a facility that can give first aid if there's, let's say, any adverse event like an anaphylactic reaction. And yes, they did give the vaccination in the car, but they were told, to wait for about 15 minutes. So it's ideal that there is like a waiting area. So there are a lot of things that you need to consider. I mean, because as we all know, we need to watch out for adverse effects, even if the child received the same antigens previously, but we also have to be cautious. So if ever we really need to do that, one of the things that, this is like a personal opinion, is that you make sure that you are near a facility that can give you first aid. I hope that answers the question, Dr. Tayag.
Yeah, thank you, Dr. Tin and Dr. Mario. Before we wind up, what's the latest on the COVID-19 vaccine race so that we can have it maybe in the next few months? Do you have any news about this?
The latest news is that there's now a phase 2 trial. And I think it was also mentioned that we are hoping that this will be available before the end of this year, maybe in November. But I hope that these vaccines will really work.
Yeah. Okay. Thank you, panelists. And now, can we get a message or two from you to wind this this hour from the panelists? Can we start with you, Dr. Silva? Your message to the public. This is being recorded. Give us your 2 cents worth of ideas, last words. Okay, your message to all of us as we wind out this webinar in the last few minutes.
Yes, Dr. Tayag, thank you. Thank you very much. And in this celebration of the World Immunization Week, we want to remind everyone that there is no better alternative to vaccination for the protection of our children. Unless we give that protection, just like we are hoping that this COVID pandemic will end soon, and everybody's talking about vaccine. Now, for all of the other vaccine preventable diseases that we have talked about, we have a safe and effective vaccine available. So please bring your children. If you love your children, protect them with the life-saving vaccine. So thank you, Dr. Tayag.
Thank you, Dr. Wilda. How about you, Dr. Tim? What's your message?
We're all one in saying that, thank you, Dr. Tayag, we are all one in saying that we really need to immunize. Let us not forget that there are a lot of vaccine preventable diseases and we have the vaccines available. That's one. The decision to immunize really would be dependent on your logistics, if you have your physical space, if at all possible, right? And if you have the machinery in place, okay? Scheduling appointments, reminding people about the importance of immunization. And what Dr. Eleenor was saying, everything is on a risk-benefit. You decide on the risk versus the benefits. But we all know that vaccines saves lives. So when we do get the opportunity, when everything has at least settled down, then let's go and do some of that catching up. Thank you, Dr. Tayag.
Thank you, Dr. Tim. And how about you, Dr. Mario Panaligan?
Yeah. First of all, thank you to Dr. Racheli de la Vega earlier for emphasizing, of course, the ways or the means on how we can vaccinate the priority groups, specifically the healthcare workers, the policemen, those frontliners who really need the vaccines to get protected. And so let's protect ourselves. Certainly, we need to update our immunization status. For the anonymous participant who requested from me to share the last two slides, those slides contain the indications as to what conditions this pneumococcal and influenza vaccines are indicated. These are, of course, for those with comorbid illnesses and those above or at least 50 years old. You know? And you can download this in the PSMID website. That's www.psmid.org.ph. Again, let's protect ourselves and let's update our immunization status. Thank you.
Thank you. And the last word from Dr. Eleenor Gumpal.
Good evening. We have to continue to stay at home. Always protect ourselves, wear masks every day, and continue the routine immunization, the routine and the catch-up immunization. And eventually, after this ECQ, we will have our door-to-door immunization. We will catch up all the children, and we will leave no child behind. So in preventing COVID, we also prevent the vaccine-preventable diseases, and the vaccine save lives. So we heal as one.
Thank you. And Dr. Tim, Dr. Eleenor, I might not agree with you on vaccine saving lives because it's vaccination that saves lives. And I know you'll agree with me more. And now, let's get back now for the last few minutes. Thank you, everyone. It's been a pleasure being your moderator tonight. Okay, the summary, we had a discussion and strategies to improve and increase vaccination coverage during enhanced community quarantine with the government and private sector. We tackled, for example, the impact or effects of the ECQ on the national immunization coverage. It has disrupted it, but we have identified the barriers for immunization, and we shared priorities for vaccination during ECQ in the target population. If it was not mentioned, we have the newborns as priorities, we have the elderly, and let's not forget the primary doses and the catch-up after the lockdown. This has all been mentioned. And because this was recorded, this will be available to you soon. Back to you, Mel.
Thank you very much, Dr. Tayag. And now for our closing remarks, let me call on Dr. Lucy Bravo, the Executive Director of the Philippine Foundation for Vaccination, to share some of her insights.
Well, what can I say for these closing remarks? But I would really want to congratulate each and every panelist, especially our moderator, Dr. Eric Tayag, Dr. Wilda, Dr. Timmy, Dr. Mario Panaligan, Dr. Eleenor Gumpal. I think everyone who shared this webinar, our first webinar for this year, which actually is our first after we have been accredited by the WHO to be a member of the Vaccine Safety Network. Ladies and gentlemen, I'd like to share this very important information that the Philippine Foundation for Vaccination website is now an accredited member of the WHO Vaccine Safety Net, the very first one in the Philippines and one of only two in the Asia Pacific region. So we're very, very grateful, and we are very happy to share this website with you. So before anything else, let me just remind you again that this webinar has been dedicated to our co-founder of the PFV, Dr. Sally Gatchalian, who was also the current president of the Philippine Pediatric Society at the time of her death from COVID. We really are devastated by her loss, but because we know that here and now, we are going to always remember that her work, her life has been dedicated to the vaccine advocacy
And if she was here, she would have been also our first expert to be with you today. So, ladies and gentlemen, before I truly end this, again, thank you very much. Dr. Shelley, this is our president, of course, Dr. Shelley de la Vega, and again to our panelists, but make sure that you are already in tune for our next webinar, which will be in May. We will be bringing to you the invitation and the webinar. The topic of this next webinar will be immunization in the new normal, as discussed by Dr. Eric Tayag. Also, please make sure that you can share your feedback to us, because we feel that only by getting your feedback and getting your questions can we be able to improve some more and really truly bring to you the information about vaccination. Eric says it all. Vaccination saves lives. We want our children and our adults and our elderly protected. So please vaccinate your kids, your loved ones, everybody else who are vulnerable, even in this time of COVID. Just make sure that you have the protective measures, washing your hands, making sure you have the necessary gears to be able to do physical distancing. So thank you and good night to all of you. We will see you next time at the PFD webinar for the immunization in the new normal. Good evening.
Thank you very much, everybody, for joining.